I'm really glad I came here. I'm glad I made this choice.
Dr. Yarden Tahan is talking about her choice to do her family practice residency at Banner Good Samaritan Medical Center.
Oh, it's a great program, very friendly, which is important because it's hard to learn and to really do better if you're nervous or scared all the time. So it's great to have such an open environment.
Tahan, a graduate of the University of Arizona College of Medicine, was a high school teacher in Phoenix before she turned her focus to becoming a doctor. Banner Arizona's chief academic officer, Dr. Alan Leibowitz, says Good Sam works hard to make sure new doctors here have everything they need to learn.
The nature of how we are, I find this a very nurturing atmosphere. I didn't create it. It was here when I got here, and it's grown, and it's having the right people in place to continue it.
And that starts with the physicians and instructors in Banner's high-tech simulation center, which is one of the first places new doctors will see patients.
And our patient today is a simulated patient that's able to respond physiologically, meaning blood pressure, pulse, eye blinking, etc.
They can react to you, they can present with certain symptoms, and you can actually do physical exam and procedures on them. That's huge because as a patient, you don't want the first time somebody does something to be to you.
And OB/GYN residents like Dr. Michael Leovic can peer inside the body and perform surgery on a patient that is nothing more than a computer program.
Having the free time to come down here and practice, it definitely improves our skills and makes it much safer for the patient.
But Dr. Leibowitz says what sets Banner apart is that even surrounded by the latest technology, the human touch remains.
Well, patient safety would be #1 goal for us. Then quality of what happens to that patient, to make sure the outcome is good. So when we talk about quality, we're talking about outcomes, that there are no untoward effects, and that the patient gets out of the hospital in this setting or out of the clinic without any harm being done.
That means residents still see patients.
So you have to be there, you have to be working with the patient, you have to be able to develop a relationship with your patients, and none of that can be done through a book. Anything hurt in here when I'm touching? Does it hurt? Where does it hurt?
My bones.
But after Dr. Tahan performs her exam, an attending physician will examine her work.
Originally there were no issues, although kind of toward the end they mentioned that she has these stomach pains.
So it's great to have, it was Dr. Kennelly or any other of my attendings, be able to point those things out and say, well, I just read this and this is the study and this is what we advise.
Definitely getting experience in the OR as well, and under close supervision having the attending staff watch us and guide us.
And Dr. Leibowitz says that includes looking at more than just clinical knowledge.
We are measuring their communication skills. We're measuring how they work on teams.
It's great to have staff and co-residents and attending physicians that you get along with.
It's also important for the patients because whatever patients I'm taking care of, my co-residents are also taking care of them in my attendings, and I don't want to give my patients to people who are mean or who don't care about patients.
More than 270 doctors train every year at Banner Good Samaritan in 5 residency programs and in numerous fellowships. Creating a program turning out the best doctors ready to deliver the best for their patients.
And everyone together has the shared goal of providing optimal patient care and having a smile on your face while you're doing it.
So it's great that I know my patients are well taken care of by everyone who walks into the room, not just me.